Hi, I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon based here in Houston, Texas. So here are several questions that have been asked over our DMs or emails or even in consultation. So what we've done is kept a running list of some of the most common questions, and I'm going to try and answer these questions with some degree of detail through this format here on video in order to help other potential patients, because if it's been asked several times, most likely you guys probably have the same question. So going right on and jumping on in here, okay? So here are the questions that have been asked about recovery after a facelift. The truth about recovery. What should I expect after a facelift? Please break down the recovery timeline, day 1, week 1, month 1. And what does the discomfort and pain feel like? Maybe some healing tips, and highlight the payoff from recovery in terms of lasting results. All right, so let's jump into this. So let's say we're doing a facial rejuvenation procedure. Okay, just for argument's sake, I'm going to say, let's say it's Monday and we're doing a facial rejuvenation procedure. What does that patient look like? First, so when I do most of my facial rejuvenation procedures, I do like to use drains. I think they really help the bruising and swelling. So when you're going home on Monday, you've got 2 drains that are coming out. They're both in the neck, okay? Number 2, there's a fancy dressing where this part is open. The rest of this has cotton and a stockinette in order to apply a little bit of compression. This is the normal outfit, I would say, that patients are wearing when they leave my office. I will see those patients bright and early on Tuesday morning. So they go home on Monday. I like to see them Tuesday. First thing I do, take a look at them and ask them how their night went. Okay, these are the most common things that I get when they tell me about how their night went. I'd say about 50% of patients will take about 1 pain pill over the course of their evening. The other 50% will either do nothing or take Tylenol. The most common complaints I get over the first night are everything feels tight. I feel so much pressure here in my neck. So once I've done my first initial examination and talked to them, I will remove the dressing. As soon as I remove the dressing, there's I feel so much better. I feel a lot more looser. I'm able to move, and I feel better. Once that's done, I'll go ahead and put the patient with the elixir machine to further speed up the healing process and reduce the bruising and swelling. And then I give them some more instructions on what to do over the next couple of days. The next time I see the patient is on postoperative day number 3, which is 2 days later. Now, when I first take the dressing down on postoperative day number 1, what do these patients look like? Most of them will have very minimal bruising and swelling. Just everything looks tight and pulled, but there's not a lot of bruising and swelling. Bruising and swelling normally takes about 48 to 72 hours to take effect. So when I see the same patient pack on postoperative day number 3, these patients now will have much more bruising and swelling. The main common areas of bruising and swelling are around the eyes, cheekbones, and a little bit along the jawline. These are the most common areas of bruising and swelling. Most of the time when I see patients back on postoperative day number 3, I'll make a judgment call on whether patients are ready for their drains to be pulled or whether we pull the drains on postoperative day number 5. Most of the postoperative day number 3 is for a lot of reassurance, telling patients, hey, they're doing okay. Because most of the time when you see yourself bruised and swollen, it's a little shocking at first. By postoperative day number 3, I'd say the vast majority of my patients are no longer taking pain medications. They're taking Tylenol and maybe just a little bit of pain medication at night. Elixir is done to reduce bruising and swelling. Fast forward, next time we see them is postoperative day number 5. When we see them on post-op day number 5, by now, I've probably 99% of patients, I'm pulling drains at this point. They will get an elixir session, and that's pretty much the main milestones on postoperative day number 5. I'd say their bruising and swelling has either peaked or has peaked and started on its way down. Postoperative day number 7, another Elixir MD cellular repair session. These patients by now are definitively on the downhill slope. I will start pulling some of the sutures in some of the more cosmetic areas where there's not a lot of tension or anything at postoperative day number 7. Postoperative day number 9, by this point, all the rest and the balance of the sutures are out. Cellular repair, Elixir MD session is done. Most of these patients are able to wear makeup and maybe go to the grocery store. They're definitely ambulatory. They're able to walk around, be themselves, do their normal daily life activities. Most patients, I have not cleared them at this point to do working out. I'll tell patients, hey, do a little bit of light walking is fine, but not workout. In the whole scheme of things, I'd say the vast majority of patients by about post-op day 11 or so are ready to wear makeup, go out and about, and do their normal things. Most of my patients are at work by post-op day 12. So that's kind of a good gestalt on what to expect in those first 2 weeks. Now, the other portion of this is healing completely done within those 2 weeks? Absolutely not. So real healing from these patients, I think, takes about 6 months for all the tissues to completely heal. You can see a drastic result. I'd say the drastic result points, you get to see the first drastic result at post-op day 1. Next major milestone is around the 2-week point. Next major milestone after that is the 6-week point. And then the next major milestone is the 3-month point. As we cross the 6-week point, moving into the 6-week, 3-month, 6-month portion of the recovery journey, the amount of healing is kind of on the down low. Swelling is on the down low, but there's still some day-to-day changes that patients will sometimes see. But definitively by the 6 weeks, patients are doing all their regular activities. They're working out. They're doing all those kinds of things. Let's see if I answered all of the questions that were asked of me. Discomfort, I'd say most patients are not taking pain medication roughly after about 2 to 3 days. After about 2 to 3 days, the pain medication portion of it is done. They're taking Tylenol. By about 6 to 7 days, patients normally are not taking any other pain medication, whether it be the prescribed pain medication or the Tylenol. Healing tips in order to promote a speedy recovery. First of all, follow the postoperative instructions. I think that's first and foremost, which include no Advil, Aleve, aspirin, or ibuprofen, because those all promote bruising and swelling. There's some post-op recovery vitamins that I recommend that are given in my patients' post-op care package. I do think that they help a lot in terms of helping people heal during that process. Other than that, basically listen to your body. I think this is a very important aspect of healing. Everybody's just a little bit different. I like to tell patients, hypothetically, if you're a person that works out a lot and you unfortunately have a flu or a cold or a respiratory infection, the first time you head back to the gym, you are not at 100%. Listen to your body. If you force your body, if you push it past its limit, what is going to happen is you're going to set your progress back. So there's a lot of listening to your body and seeing how your body feels. Same happens after facelift surgery. I think you really do need to listen to your body, see what it feels like, and then kind of take baby steps. I will give you the framework of things to do and things not to do, but then there is this portion of listening to your body. Other things that I think that help the healing process, Elixir MD definitely helps. Healthy nutrition, healthy hydration, minimizing alcohol and caffeine, these types of things. I have a huge list of things in my post-op book. I think all of these things together, the sum is greater than or the total is greater than the sum of its parts. So I think all these little things contribute to a successful healing. From a surgical standpoint, from my standpoint, I think that very careful dissection, meticulous dissection, being adherent to all the different surgical planes, adherence, very strict closure of the tissues, all of these things also help with healing patients. Main things that I feel from a psychological standpoint on patients, there is a definitive psychological kind of down phase at about the post-op day 2 to post-op day 7, that little box right there. I think what happens is when patients first see their initial result, there's this exhilaration of, oh my God, there's this sharp neck, sharp jawline. And then as the bruising and swelling takes effect, their mental status kind of goes down a little bit. Things that I tell patients is be cognizant of this. Definitely kind of listen to your brain. Know that this is a standard portion of that healing process. By kind of adhering to it, acknowledging it, and going, this is temporary, you can really kind of bring yourself out of that little slump and bring yourself back up to where you're supposed to be. So that, I think, is definitive, happens to a good chunk of my patients. And right at about that 10-day to 2-week standpoint, when they really are seeing the results, then they get out of that slump. But I think that that's something to acknowledge and know that it does exist, because I think it does hit a lot of patients, and glossing over it is not a good way of dealing with the situation. So I hope all of this has given the viewer here a very good understanding of recovery after a facelift. So kind of key take-home points. Recovery really is about 10 to 14 days in terms of being able to get back to normal. However, long-term healing does take up to 6 months to heal fully. There is a psychological downturn in patient mental profile, roughly post-op day 3 to post-op day 7. It's temporary, but definitely needs to be acknowledged so that we can work through that. If you found this content engaging, interesting, you learned something, please let us know. Please give us a thumbs up. Please subscribe to either our channel or give us a like. It really does help us. If you have feedback for us, things that you want to hear about, other questions that you'd love for me to chat about, please do send it to us and we will include it on our future videos. Thank you so much for listening. Dr. Athre, Athre Facial Plastics.